Hello there, Dr. CalmingEscape. I'll be right with you. Alright, so welcome on in. Is this your first time here? Okay. To get started, I just have a couple questions for you, and then we can kind of get in on my expertise and figuring out what exactly we can do for you. Okay? Good. Okay, so physical and medical history, I believe, correct me if I'm wrong, you sent that over from your normal doctor's care? Okay. Good. Are you on any medications right now? What's the dosage on that? Okay. Any blood thinners? It's very important. If you were to decide to have any sort of surgery with us, we would need to know if you were on any sort of blood thinners. Okay. Now, have you had any previous facial surgery? Okay. Any sort of cosmetic surgery at all? Okay. Alright. Any sort of facial traumas that I should know about? And when was that? Okay, so that's been a bit. Good. Have you had any issues with skin cancers? Okay. Have you participated in any sort of skin therapy? That could be a variety of things, really. Some methods of facials that you would find at spas or clinics can be in the category of skin therapy. Okay. Yeah, it can be light therapies. I mean, some people even consider different Botox treatments to be skin therapies. Okay. And then, of course, any sort of Botox or injections that you have received. Okay. And what about allergies to anything? That can be foods, that can be general spring allergies, that could be medications. Okay. And any problems with anesthesia, to your knowledge? Okay. Any family members? Okay. Okay. So I'd like to hear about what exactly you have come in for, what you consider to be your problem areas or the parts of your face that you have trouble with. I personally think that you are beautiful, and we are of course here to make you happy with any adjustments that you may want to make. Okay, so which areas are you concerned about? Okay. Okay. Right. Well, let me grab. Here is this mirror here. If you can just look in this mirror and kind of point out what you're seeing when you look in the mirror. Okay. Okay. Right. Okay, so those are very common areas that we see people requesting cosmetic treatment to their facial area. They're very common. What would you say that your goals are with treatments, surgery, injections, etc. What would you say your goal is? Right. I do consider every treatment very carefully for each person. Everyone is different, so their treatment is going to be different, of course, and their goals are going to be very different. Yes, well, I pride myself on not having any sort of botched clientele leaving my clinic, so yes, I take it very seriously, of course. Okay, so those areas there, as I said, are very common, and your goals seem to be very realistic, which is very refreshing. Okay. How long have you been considering cosmetic adjustment, surgery, etc.? Okay. And you are here of your own free will. You don't have anyone pressuring you or anything to do this. It needs to be your decision. It's your body. Perfect. Okay. Well, I'm going to offer you my expert opinion on your lovely face. We're not going to do anything too extreme. As I said, I'm not a fan of the botched looks. But we want to make you to a level that you are happy with, of course, and you alone. That's why I want to make sure that no one has pressured you in to coming in today. Yeah. Okay. Okay. Just gonna have a look at your face, if you don't mind. Me touching your face? Is that okay? Alright. Good. Your skin has a lovely texture and great elasticity as well. Just have you tried any sort of at-home treatments with your skincare plan or anything like that? Okay, that's okay. And your forehead. Can you wrinkle your forehead, like kind of look up? Okay, kind of furrow your brow there. Okay. Smile great big. Let me see your teeth. Okay, you can relax your face. Can you go ahead and squint for me? Gonna look back kind of along your cheek to your ear. Down along your chin. Okay. Okay. So here and here. Okay, a little bit there. Okay. These are all very natural aging areas. No, I would not recommend anything as severe as like a full facelift or anything for you. We have some methods that will be very natural looking and not as severe, which means your recovery will be not as severe for you. That will just give you a little bit of a more youthful look if you so request. This will be done combination of ways, with combination of injections and, you know, a little bit of surgery and stitching. But luckily enough, the stitches will dissolve on their own. You don't have to worry about that sort of recovery or the removal of those. Where we would also place those select stitches, if you so decide on a procedure like this, along the creases of your face. Which basically means the crease along here. You see the natural crease that your face has. Yeah, that's where those stitches would go, right there. And then we could do a little bit of injections as well, just depending on what exactly we decide on. You know, a lot of people bring up celebrity looks, and I usually don't like to compare celebrities to your face, because your face is your face. It is not a famous celebrity's face. Some people request their lips or their cheeks to look a certain way, similar to that celebrity, but I think it's very important to do the adjustments to your face that will fit your bone structure, your facial features. So you can always give me someone that, say you really like their lips or something to that effect, but I'm always going to adjust it, if you like, so that it fits your facial features. It's going to be more flattering to you in the long run. Make it look more natural instead of just specifically going after looking like a specific person. It's going to be geared directly to your care and what you are wanting in a more natural way. Okay? Okay. Good. Alrighty. Let me just see here. So my assistant can give you some more details on the exact procedures that we would do if we would go along the contours of your face, basically, and if we want to do any sort of Botox treatment, things of that nature. Okay. Let me just check your history here real quick. Do you have any questions for me? Recovery would be very quick. It's not a huge surgery, I would say. Okay, Yeah, there would be minimal bruising. We're not doing anything relating to liposuction. That's where you would really get a lot of bruising. Yeah. I like to think that I have a very gentle touch, which maybe that's why I'm more popular with a more natural look, if you will. Pairs nicely with your natural beauty, of course. Okay, so let me just grab real quick for us. Okay, let me just make a couple marks on your face so you can visually see where, just gonna tuck your hair back, incisions would go. Okay. Go ahead and look in the mirror here. Yeah, so you can kind of get an idea of what we would be going for if we did that minor procedure with... Okay. Does that sound like something that you would like? Okay, of course. Well, I always recommend that my patients think about it. I do not want you to jump into a procedure like this that is going to be changing your face slightly. I don't want you to just jump into it. You need to be very serious about it. So I would ask that you go home with our information, with what I've told you today, and really just think if this is right for you, of course. Let me just grab something real quick. Okay, I'm just gonna wipe off that pen real quick. Well, we're not doing your surgery today, obviously. You need to think about it. I just wanted you to have a visual of if you wanted to do this procedure, where exactly the incisions would be and how we would do it. As for your lips, if you wanted to do something like that, it would really depend on how big you are wanting, or as I said, I really like for my patients to be unique in their own facial features, so it would depend on how we would decide the symmetry of your facial features and your bone structure. Okay, good. So lots of decisions to make. Do not take it lightly. If you have any questions for me, you can always call the office and I can answer anything. They're going to have all of the details that I've laid out for you today out at the front desk, so you can take that home and really just think it over. Okay. Well, it was really nice to meet you. And as I said, if you have any questions, don't hesitate to call. Alright. Bye now.